I'm Sarah Kirsch. Through the experiences of having a younger brother with autism and volunteering for Autism Speaks, I have been a long-time advocate for individuals and families affected by autism spectrum disorder. Also, I'm very interested in a career in emergency medicine. For these reasons, I wanted to pursue research that would contribute to optimizing emergency room experiences for children with autism and their families. So, I teamed up with Dr. David Mariash, Developmental and Behavioral Pediatrics Fellowship Director at Cohen Children's Medical Center of New York. He was my mentor for this project. Patient satisfaction has become an important indicator of quality throughout our healthcare system. In recent years, especially because those with ASD constitute a growing population with a disproportionately high utilization rate, there has been a focus on meeting the special needs of these individuals as they navigate the healthcare system. For many reasons, but in particular, their often extreme sensitivity to environmental stimuli, a visit to an emergency room can be extremely challenging for children with autism and, of course, their families. We set out to identify the factors that most associate with parent satisfaction with emergency room visits. Most important for us was to obtain information that would identify opportunities for improving and maintaining high levels of satisfaction. We recruited parents through the Interactive Autism Network, which maintains a national registry of families of individuals with ASD. Our subjects were parents of a child between 3 and 21 years of age who had been treated in an emergency room or urgent care center within the past 3 years. Parents completed an extensive, confidential and anonymous online questionnaire about their child's visit. We asked parents whether they strongly agree, neither agree nor disagree, or strongly disagree that they were satisfied with the emergency room visit. Overall satisfaction with the visit was our primary dependent outcome variable. We also asked about parent and child demographics, including the child's degree of hypersensitivity to various environmental stimuli, and the child's communication skills, specific ASD diagnosis, and the intensity of their special education services. These last three were treated as proxies for disability severity. The parents also answered questions about the visit itself, including whether they brought with them copies of their child's medical records, characteristics of the treating facility, reason for the visit, wait times, procedures the patient underwent, and whether the child was disruptive during the visit. Finally, parents were asked to report on their observations of 9 staff behaviors, which represented the quality of staff's interpersonal and communication skills. For example, we asked parents whether they were satisfied with the direct care staff's explanation of procedures, test results, and treatments, and whether the staff communicated directly with the patient at an appropriate developmental level. 378 parents completed our questionnaire. Data analysis was designed to demonstrate the distinct and relative effects of individual variables on satisfaction with the visit. It was rather striking that among the 10 most important determinants of parent satisfaction were the 9 factors representing staff interpersonal and communication skills. Interestingly, parent satisfaction did not associate with any of the 3 measures of patient disability severity, whether the child is hyperreactive to sensory stimuli or the reason for the patient's visit. So, if you were the director of an emergency department or ED, how would you direct your resources to maximize visit satisfaction for children with autism and their families? Our findings strongly suggest that the ED experience can be most satisfying if both direct care and support staff have sufficient understanding of individuals with autism and how their communication skills, perceptions of sensory stimuli, and behaviors are affected. Staff should also be taught useful strategies for caring for and communicating with patients with ASD, such as the importance of listening to the patient's parents because they are the experts on their child. We believe that staff education, including simulation training, is key to ensuring family satisfaction with ED care when the patient has autism. We hope that ED and hospital administrators will agree that this is a worthwhile investment of resources. We invite you to check out our full article in the journal for a more detailed discussion of the background for our study, our findings, and our recommendations.